I'd like to thank Sinn Féin for bringing forward this motion, which I'm happy to support. I won't get into the discussion about whether it goes too far or far enough, other than to say I bow to the knowledge of people who are in the region, whether they're campaigners or political representatives who I'm sure know a hell of a lot more than me about the details of what's happening to the health services in that area. I'm sorry you're gone, Stephen. I had some important points to make to you, but anyway, he's gone.
He's back.
Good. Fair play to you, Minister. So, other than to say I support the motion, and obviously the case of Aoife Johnston, her tragic and unavoidable death, should be a wake-up call for everybody. That something like that shouldn't have happened is absolutely tragic and no doubt linked to massive overcrowding and the fact that she was left on a trolley for 13 hours without the medication she needed to save her life, but which almost certainly could have been saved with that medication, without that overcrowding and without that chaos in the emergency department. That is an indictment of our health service, that something like that can happen. And I'm very acutely aware that week in, week out, the crisis in the emergency department in UHL is raised. And what I will say from my own point of view is it's eerily familiar to the arguments that are made in this motion, the arguments that were made when St Michael's Hospital and Loughlinstown Hospital emergency departments were downgraded, supposedly as part of a project to develop a centre of excellence in St Vincent's Hospital, as part of a hospital group. And all that has happened since is that on a regular, ongoing basis, St Vincent's faces a similar trolley crisis of people left for hours and hours and sometimes days left on trolleys. It happens on a regular basis. It hasn't worked, right? It hasn't worked. Now, the point I want to make to you before you go is that I'm not a health spokesperson. I would not on a week-in, week-out basis sort of be dealing with you on the details of what's going on in the health service. But I'm very aware that the government announced that there was a lifting of the recruitment embargo in July of this year, which health workers had said was seriously inhibiting their ability to recruit the staff they need in understaffed hospitals and in other areas of our health service. Over the last number of weeks, unprompted, I started to get a series of desperate phone calls from staff members of all different grades in St Michael's Hospital saying that the staff were utterly demoralised and that patient safety was being seriously compromised in St Michael's Hospital. That people were being pulled from one place onto places they shouldn't really be in order to fill gaps in every area of the hospital, that physios weren't available for people on the wards or were being pulled from one place to another, that there was problems in catering, the staff in catering, nursing, and so on and so forth, right? People panicked, demoralised, and saying that despite their understanding there was a lifting of a recruitment embargo, that in fact an effective embargo had been imposed, a staff ceiling, staff quota had actually been imposed in June, called the pay and number strategy. I personally had not heard about this, right? Now I'm just telling you, because I've raised this with the Minister, and he's saying, oh, we have to have some kind of control on recruitment and all the rest of it. I am telling you from St Michael's Hospital, and now I heard it in the National Rehabilitation Hospital when I went up to the opening of the new wing, because I said, have you heard of it? I said to the people in the NRH, I've been hearing about in St Michael's this pay and number strategy and the impact it's having on the staff and on patient safety. And I asked the people in the NRH and they said, oh yeah, exactly the same here, right? Exactly the same here. Then I ring the INMO and I say to the INMO reps, I said, have you heard about pay-in numbers. Oh yeah, we've heard about pay-in numbers. It's endangering patient safety across the health service. Right, that there is, by another name, an embargo being imposed on the pay-in number strategy, where ceilings have been put on recruitment based on who was in post in December 2023. And in one case, I was absolutely shocked when I heard this. I met the representative of the public health nurses in my area at the INMO briefing, where she said that there were something like, I think she said 11, but you can correct me if I'm wrong, but a significant number of community health nurse, public health nurse in the community posts had not been filled at that point, and now those posts have just gone. Just gone. Right? So this is the impact of this thing. And this is happening in St. Michael's and elsewhere. Now, this is crazy, right? This is absolutely crazy. Arbitrary staff quotas and ceilings being imposed with the consequence patient safety is being seriously endangered, and our the workforce in the hospitals absolutely demoralised. I cannot overstate to you how demoralised the workforce are. We're organising a public meeting to discuss this in our area in the next couple of weeks. You're very welcome to come along, Minister, or to send a representative, prompted by the concern and the demoralisation and the panic, essentially, of the workers in the hospital. Last thing I just want to say, I was contacted by people in St. Luke's Hospital who've also asked me to ask you directly, are you going to act on the National Radiation Therapist Review report and recommendations? Because they say, again, staffing levels, that huge numbers of machines, scanners and other equipment to treat cancer are sitting idle and not being used across the country, including in St. Luke's Hospital, because of lack of staffing. Again, staff quotas or whatever being imposed. We cannot endanger patient safety by arbitrary staff quotas and ceilings and embargoes, or whatever name you want to put on them. Staffing has to be based on patient safety.